Hey there, I'm Joshua Johnson. It's good to be with you on this Thursday, December 16th. Here is just some of what we're talking about tonight. It has been nearly 2 years since the COVID-19 pandemic upended our lives. Now, Omicron has many worried that we're back at square one, or worse. We'll answer more of your COVID questions and update the Biden administration's latest pandemic plans. A group of missionaries is free tonight, months after being kidnapped in Haiti. 17 people with ransom demands over them. What happened, and what does this mean for Haiti? Also, a number of cities are putting restrictions on feeding the homeless. We'll explain why one New Jersey city is proposing permits to give out food. And we'll share some of your moving stories about the harsh realities of homelessness. Let us begin tonight with a lot of new developments about the Omicron variant. In the last month, the U.S. has seen a 40% increase, 40%, in both COVID cases and hospitalizations. Lower courts have blocked the Biden administration's vaccine mandate for healthcare workers. Well, this evening, the White House announced that it's asking the Supreme Court to restore the mandate. All of this is happening as the pandemic causes new disruptions in our holiday season. The surge of cases in New York has caused some Broadway shows to cancel performances. Hamilton, Tina, Mrs. Doubtfire, Harry Potter, and Ain't Too Proud, all canceled. Also, Citigroup told its staff to work from home during the holidays. Goldman Sachs has reportedly canceled its holiday parties. And a growing number of universities are shifting final exams online, requiring vaccinations for next term, or both. The CDC is predicting a steep rise in COVID cases and deaths. Right now, Omicron accounts for just 3% of the country's COVID cases, but those cases are doubling every 3 days. Dr. Anthony Fauci told NBC's Lester Holt that Omicron is the most contagious variant we've seen.
We can expect in the next few weeks, as we come to the end of December and the beginning of January, that we likely will have Omicron as the dominant variant in our country.
Meanwhile, there's a big development on the Johnson & Johnson vaccine. A CDC panel has recommended that Americans get either Pfizer or Moderna instead. The J&J vaccine carries the risk of very rare but potentially life-threatening blood clots. And moments ago, the CDC officially endorsed the recommendations from that panel. Joining us to help make sense of these developments are two of our medical contributors, Dr. Ebony Hilton and Dr. Natalie Azar. Welcome to you both. Good to see you. I wonder if we could start with that last bit about J&J, Moderna, Pfizer. Dr. Hilton, let me start with you. If I'm somebody who got the J&J vaccine, and now the CDC is saying you really should do Pfizer or Moderna if you can, does that mean that I'm in danger, that I'm in trouble? What does that mean for people who already got J&J?
Right, and I know it can be very confusing for persons, and I have to just stress with the public, if you are vaccinated with any vaccine, you are far more better off protected than if you had no vaccine at all. Let's just say that for the record. But what we're seeing with the studies is that if you have the J&J vaccine and you get the Moderna vaccine as your booster, then your antibodies go up and increase about 76 times. If you got the J&J and you get the J&J booster, it goes up about 4 times as far as your antibody level. So that's why they're encouraging those persons who had the J&J that, yes, you still have some version of protection that is better than if you were not vaccinated at all. But for that booster shot, look at that Moderna, look at that Pfizer vaccine for that mRNA vaccine booster.
Dr. Azar, the CDC is predicting a rapid rise in COVID cases and deaths, as many as 15,000 in the first week of January. That's the CDC's prediction. What is behind this? Is it Omicron? Is it the lingering effect of the Delta variant, or maybe something else?
Yeah, you know what, Joshua, I think it's probably going to predominantly be because of the Delta variant, in spite of the fact that we are seeing a doubling time of 2 days instead of 2 weeks with Omicron as opposed to Delta. The Delta variant is still the predominant one in this country. We've seen a surge of cases following the Thanksgiving holiday, and I think most experts are anticipating that we're going to see the same surge following the the December and Christmas holidays and New Year's. And so unfortunately, we're already at about 11 or 1,200 deaths per day. It doesn't take a lot to get to, almost twice that in the first week of January, unfortunately.
Dr. Hilton, why is that? What do we know so far about how the Omicron variant attacks the body differently than the Delta variant or the original version of COVID we first saw 2 years ago?
All right. Well, we see with all these variants that have been of concern is that they do evade the immune system a little bit better than the one before it, right? But we know this, which is, again, to the American public. If we know how the virus has mutated and we know that it could be more transmissible, then we go back to what we said in the original game plan was to mitigate the spread. And we mitigate the spread by wearing our masks, by now getting our vaccines, by getting those booster shots, because what we see with studies is that if you're fully vaccinated and boosted, then you have a 10 times lower rate of actually getting infected from COVID-19. So remembering those things, we can get through this if we follow the game plan, which means we have to be hypervigilant.
And Dr. Azar, I just want to be clear. This is kind of basic stuff, but just to kind of be clear about this, the point of getting vaccinated is not to say it is impossible for the virus to get into your body. It's not a force field, it's a vaccine. The idea is that if it does get in your body, it's vastly less likely to make you sick and vastly less likely to kill you. Do I have that right?
You do. And, I actually explained it to a patient today, and I thought almost a little bit with graphics, meaning using it with my hands. But if you think of it this way, when you get vaccinated, your body develops antibodies. Those antibodies basically reside in your airway, in your nasopharynx. And so they are the first line of defense when you are exposed to someone, let's say, who's coughing or sneezing on you, because that's how the virus enters the body, through the airway. But after a certain period of time, those antibodies go away, and we expect that. But the whole point of boosting is to ramp up those antibodies again so you're protected from that initial exposure, which just translates into protection from infection. But what antibodies have nothing to do with are the B cells and the T cells, that other part of the immune system that has been activated by vaccination and by natural infection. And those B cells and T cells reside in multiple different places in your body, and they're there to protect you from severe disease. Let's say if the virus escapes or makes it past the upper airway and goes into the lung and other parts of the body. So yes, you have it correctly. And I was just sharing what I shared with my patient today.
Dr. Hilton, let me get to some viewer questions, including a very common one. What booster or vaccine provides the best protection against Omicron? The CDC has come out today saying it's not J&J. If you have the option, take Pfizer or Moderna. And now we're kind of in an era where people are like vaccine shopping, which is new. But I understand why people are trying to do that. So should you ask for either Pfizer or Moderna, or are they both kind of on par with each other?
Right. What we've seen is that, especially with the mRNA vaccines, they do have a more of a boost of your antibody response. And so getting that Moderna or that Pfizer, whichever is offered at that center, if those two are the ones that's offered, getting either one would be your best bet. But I have to, again, urge people to let those know we cannot rely on vaccines and boosters only. We have to use all forms of mitigation in order to combat COVID-19, especially during these winter months. Because what we're seeing is that even in those states that have high vaccination rates and high booster rates, that we're still seeing an increase in their cases because it's cold and people are going inside. So wearing those masks, specifically N95 masks, if you can get those, making sure you're practicing those social distancing and avoiding those indoor large crowds, that's the way that we're going to be able to fight COVID-19. We cannot be just one plan. We have to use all strategies.
Yeah, with regard to avoiding large crowds, Dr. Azar, do you think that people should start just canceling their plans, preparing for a kind of a shutdown light as a result of this? I mean, I just saw, a tweet from Jackson Memorial Hospital, which is the big public hospital system in Miami-Dade County, saying that effective tomorrow, they're going to change their visitation policy to one healthy visitor per day. You must have a scheduled appointment, visitation with a current patient, or an emergency requiring medical attention. This is a big deal for Miami-Dade County's public hospitals to say we're going to limit the number of people who can show up at the hospital where you're supposed to show up if you can't go anywhere else. Does this mean that we're kind of doomed to scale back all of our social and interpersonal plans in 2022, Dr. Azar?
Look, I mean, I certainly understand the rationale for doing that. You're basically wanting to de-densify indoor areas. That's why, even in spite of the fact that many college campuses have gone remote for final exams, we do know that they were trying to do the right thing by having 50% of their student body in the classroom, but we know that many of the infections were acquired or contracted off campus. But look, nobody wants to have to go backwards. What I would say to folks is this. You're always taking into, your calculus really starts with your own risk tolerance. If you live with members in your family who are at risk, you're going to be more cautious about your behavior. We do understand now that Omicron is definitely more contagious than Delta. Hopefully, truly does not cause more severe disease. But all of the things that we've been, really preaching about for the last 2 years that will protect us will hopefully protect us against Omicron, especially if you've been boosted. But this whole concept of, shutting down and going backwards and things like that, it is truly, truly unfortunate. The problem really is that even though the vast majority of people who are infected with Omicron, especially if you've been vaccinated, I'm referring to vaccinated and boosted individuals, will very likely not have severe disease. A subset of us can and will. We should not inflate, the Omicron variant too much with the common cold. The common cold doesn't cause 800,000 deaths in 2 years.
And since you mentioned more common diseases, Dr. Hilton, I'll finish with you. And another one that always comes around this time of year, Ben tweeted, will we need to take COVID-19 vaccines regularly each year, just like taking the flu shot? Dr. Hilton?
Right. And that is still yet to know, right? We're still collecting data along the way. I think what people have to understand is that this is not just like the flu shot. As Dr. Azar was just saying, in this total pandemic, we've lost more people in the last 2 years from COVID-19 than we did from 41 years of the AIDS epidemic here in the United States of America. That's how dangerous this virus is. So it's not just like the flu shot. And if we had to get where we have another vaccine or another dose of this vaccine within the next year, I think people have to understand and allow for science to prove that to us, and be patient with the process. What we do know is that the scientific process has proven itself, that it is safe, that they're following all the check boxes before we allow this to roll out. That's why our children at this point, up to the age of 5, cannot get a vaccine because it hasn't been proven to be safe for them yet. And so trust that process and know that if it comes that time where we have to get that dose every year, it's because the science backs that up.
Doctors Ebony Hilton and Natalie Azar, we appreciate you both coming on to explain some of this science to us. Thank you both very much. Now, for all the resistance to vaccinations, one sector has been amazingly compliant: the United States military. As of today, 94% of Marines are fully vaccinated. Only about 100 Marines have been kicked out for refusing. As impressive as that is, and I know I risk the wrath of devil dogs everywhere, the Army's got you beat. 96% of active duty soldiers are fully vaccinated. 98% have had at least one dose. Almost 4,000 soldiers are refusing. They have until January to comply, or they could also be removed. But another statistic caught our eye, the one at the bottom. Among the soldiers who've refused, almost 1,800 applied for religious exemptions. So far, all the requests have been denied. The Marines have not granted any either. Religious exemptions have been coming up at more workplaces, including soap operas. This week, ABC wound up in a real-life drama with actor Ingo Rademacher of General Hospital. He's suing the network, accusing it of religious discrimination. Mr. Rademacher says he was denied a religious exemption.
If you want to go get the vaccine, get the vaccine. If you think it's going to protect you, that's great. But you should be able to make that choice.
And this drama at General Hospital is a rerun. Last month, another cast member, Steve Burton, was fired for remaining unvaccinated. He had been denied both religious and medical exemptions. Now, it's one thing to let someone off the hook if the vaccine would hurt them medically. But spiritually, religiously, how do you assess that? That can get very tricky very quickly. Then again, the military has not approved any exemptions, so maybe it's simple after all? Either way, we'd love to hear from you if you've dealt with this firsthand. If you have applied for a religious exemption, how did you justify it? and what was the outcome? Or if your employee has requested one, how did you handle it? Tell us your story. We are at NBC Now Tonight on Twitter, Facebook, and Instagram. Leave us a voicemail, 888-575-2NBC. That's 888-575-2622. Or email us nowtonight@nbcnews.com. We will share some of your stories tomorrow night. Still to come, a hostage situation is over after 2 months of captivity. Missionaries in Haiti are free tonight. How did they get free? And what do we know about their captors? We're glad you're with us for Now Tonight from NBC News.
We are thankful for the FBI, the State Department, and Haitian law enforcement officials who have been working tirelessly to get these missionaries safely home.
Abortion access is in the hands of the Supreme Court now, but not entirely. Today, the FDA announced that it will permanently let patients receive abortion pills by mail. Under a new rule, women will no longer have to physically go to a clinic or a medical office to get the medication. They'll be able to get a prescription after an online consultation. The FDA eased in-person requirements during the pandemic, and now this rule will disappear permanently. Of course, today's move may add more fuel to the national abortion debate and perhaps prompt legal challenges. We'll keep you posted. It's easy to get caught up in the drama of a hostage situation, especially since they often do not have happy endings. But in Haiti, there's a lot behind the standoff that just ended. If only the end of the standoff were the end of the story. The captors were a Haitian gang called 400 Mawoso. They abducted 17 missionaries back in October. Now, all those missionaries are free. The gang released the last 12 of them today. 2 were let go last month. Another 3 were released earlier this month. The missionaries were in Haiti with Christian Aid Ministries, a group based in Ohio. They got captured on their way back from an orphanage to the ministry's base in Haiti. 400 Mawoso had demanded $1 million ransom for each of the 17 hostages. It's unclear what they got, if anything. It's also unclear what physical condition the missionaries are in now. But what is clear, unfortunately, is that more abductions will probably happen. According to the Center for Analysis and Research in Human Rights, so far this year, Haiti has seen nearly 800 kidnappings at least. This includes both local and foreign victims. And this is on top of Haiti's other struggles. It is still investigating the assassination of its president, Jovenel Moïse. He was killed back in July. And in August, a major earthquake struck. More than 2,000 people died. So this kidnapping, as dramatic as it was, is only part of Haiti's story right now. And it's looking to the U.S. to help it turn the page. So what are the Biden administration's plans? And what more do we know about the missionaries or this gang? Let's get into it with Jacqueline Charles, my former colleague at the Miami Herald. She has extensive experience covering Haiti as the Herald's Caribbean correspondent. Jackie, it's good to see you again. Welcome.
Good to see you, too. I miss you.
I miss you, too. And as soon as I saw this story, I was like, I know exactly who I want to talk to about this. Before we get into some of the context behind what's going on, can you tell us a little bit more about the way all of this ended? Do we know anything about the circumstances under which this last release happened?
No, everyone is being very tight-lipped. I can tell you that the 12 missionaries, they were at the diplomatic lounge of the airport just a few hours ago waiting for a charter flight to be flown out of Haiti. I broke the story that they had been released, and that's because I had a source who called and said that this just happened. And the understanding that I have is that they were basically dropped off at a mountain at the edge of this territory that they control. There's no voice note that's going around that's claiming that they walked out at 3 a.m. in the morning. We haven't found anything to back this up. I mean, they've been held for 2 months. This is the longest that any group of hostages have been held, that we know publicly. So even that in of itself is highly unusual in terms of the kidnappings that happen in Haiti.
Talk about this gang, 400 Mawoso, what we know about them, and how this kidnapping fits into the larger landscape of kidnappings in Haiti. I mean, are they mostly political statements? Are they just for money? What do we know?
You know, what's happening in the country right now is a free-for-all kidnapping, and anybody could be a victim. I mean, while these 17 individuals were being held, we had kidnappings of former French diplomats, we had kidnappings of American citizens, we had students, and people weren't talking about them, but they were still happening. This gang, 400 Mawozo, Katsa Mawozo, their MO is collective kidnappings. They will kidnap people by the busloads, by the carloads, and they were doing this for quite some time before this incident happened on October 16th. And they were doing it in order to stay under the radar. So instead of asking for $200,000 or $1 million per person, they was basically asking for $20,000 or $30,000 for the busload of individuals. So it's easier for people to get that money, and then they would be free. But we also know that earlier this year, they also kidnapped a group of Catholics, priests, and nuns. The longest, I think, was held for like 21 days. And that's when people really started to pay attention to this gang. They went from, you know, stealing cows to cars, to kidnapping, to taxing people. They control one of the largest territories of Port-au-Prince. And so that makes them very dangerous, because when we're talking about a territory, we're talking about east of the capital on the road to the Dominican Republic. So just imagine.
There was a statement released by Christian Aid Ministries with regard to this kidnapping. We glorify God for answered prayer. The remaining 12 hostages are free. Join us in praising God that all 17 of our loved ones are now safe. Thank you for your fervent prayers throughout the past 2 months. We hope to provide more information as we are able. Talk about the relationship between the nation of Haiti and the United States, both aid organizations who go there to do charitable work, the administration in power at the time, organizations like the U.S. Agency for International Development. I flew on a USAID flight years ago to survey the damage after an earthquake in Haiti. But all of these relationships are vitally important to Haiti, especially now that there's this assassination of President Moise to be investigated.
Well, nonprofit or NGOs, as we call them, they are the safety net of this country. In 2010, that earthquake that you went to cover, I mean, Haiti was referred to as the Republic of NGOs. There was a number that was being bandied about that there were over 10,000. Today, they're on. A lot of them have left. But when you're on flight to Haiti, you see groups like these all of the time. In this particular case, these individuals are part of the Mennonite, the Amish community. You see them, they dress very conservatively. They are in the countryside. There are places where the government is absent, social services are absent. And so they are revered and loved by the community because of the services they provide. It's not just religious education, but it's healthcare, it's potable water, things that we take for granted in this country, or we just assume, everybody should be entitled to. So there is that relationship there, and you have to wonder what has happened, what impact that is going to have on other organizations today in terms of their own fears, their reluctancy to go down to Haiti and to continue to provide assistance.
Right. Before I have to let you go, I know that there's a major State Department meeting tomorrow regarding Haiti. Do we have any sense of what that will involve, or maybe, if not that meeting, but just kind of what the next steps are in terms of how the U.S. responds to what's going on in Haiti before we go?
So as you understand, this is a year of crisis for Haiti. February 7th is supposedly when the end of Jovenel Moise's term is supposed to end. So the United States is really like on a timeline here. And the biggest issue is the security. So that's going to come up tomorrow, where it's going to be looking for France, the OAS, the UN, to see what they can do to help in terms of the security issue. And then there's the issue of economics and governance. Right now, 4.2 million Haitians are on the verge of deep hunger. We still have this hurricane from the 14th of August, and people have not been able to get assistance because of the gang fighting that's going on in Port-au-Prince. 19,000 people have been displaced from their homes. This is a country in chaos and in crisis. And so we see, after months of pressure and of not doing anything, you see the Biden administration now trying to say, what are we going to do? So I'm going to be looking at this very closely, as well as Haitians, to see what comes out of that meeting. Is it something different, or is it more of the same?
Jacqueline Charles, Caribbean correspondent for the Miami Herald. I really appreciate you making time for us tonight. Thank you very much.
Thanks for having me.
We got a lot of responses for our next story about feeding the homeless. Should you do it yourself, or let your city government lead the way? Newark, New Jersey is planning to require food permits for that. We'll get into the plan, the pushback, and your personal stories of dealing with homelessness just ahead. Stay close. People living on the streets often struggle to get a hot meal or any meal at all. New Jersey's largest city is working on a way to restrict giving food to the homeless, but the city argues that it's for good reasons. A spokeswoman for Newark's mayor, Ras Baraka, tells the New York Times, quote, "The ordinance the city is working on will prohibit agencies and individuals without a permit from feeding residents without addresses. All violators will be ticketed and fined," unquote. So what's behind this move? And what should we know about what homelessness can be like? Joining us now to help answer that is the author of that New York Times piece, Andy Newman. Mr. Newman, good evening. Welcome.
Thanks, Joshua. How are you?
I'm well. I'm curious as to what led up to this ordinance that Newark is working on. Was there something in particular that led the city to work on making this change?
So there's been kind of an ongoing conflict in Newark for years. There are a lot of homeless people that gravitate towards Newark Penn Station, which is the main train station in the city and one of the busiest stations in the country. There's a park behind the station where a lot of homeless people gather there also. And because homeless people gather there, people who want to help the homeless come there, they bring food, and sometimes at the park, there's complaints about messes, about people going to the bathroom in the park, about people just leaving a lot of food behind. And this is all happening as the state of New Jersey is pumping a ton of money into fixing up the train station, and downtown Newark is undergoing a lot of gentrification and redevelopment. And so there's kind of this tension between people who really want to see things getting spiffed up and people who want to help the homeless people, and homeless people themselves sort of get caught in the middle of it.
The city has responded to some of the criticism by noting that there is an array of things that it is doing in its homeless outreach. First of all, it says that this measure is designed to make sure that there's safe handling and distribution of food for the homeless, basically to protect the people who are consuming it. They are asking people not to show up around Penn Station and feed the homeless there for the reasons you just listed. The city also noted that they just established an emergency shelter called Newark Hope Village, and that they fed nearly 2,000 men, women, and families during the pandemic. So it sounds, Mr. Newman, like the city says it's got good reasons to do this, and that some of the pushback maybe is misdirected?
I mean, the city is definitely doing a lot to help homelessness, which is getting a lot worse in Newark. The groups that come into the city to feed people, what they're saying is, you know, we need to meet people where they are. The city's saying that kind of giving food to people in these public places the city actually said it actually encourages homelessness, because I guess if you get a free meal in the train station, you're going to want to sleep in the train station. The relief groups that have been coming in and feeding people thought that this was kind of a strange way to look at it, because what they say is if you want to get people off the street, you got to meet them where they are, start by giving them food, win their trust, and then you can kind of connect people to services, to housing, to addiction services, and all the things that are really essential if you want people to get off the street and into apartments.
We heard from a number of you about your stories related to homelessness. Some of you who are still dealing with homelessness now. Here is a voicemail that Chris left in our inbox. Listen.
I'm living in my car right now. February 1st will be 2 years. I work a full-time job, make a good pay. I can't afford a rent, not with college tuition, child support, all them other bills. I don't know how I've done it. I really don't. If I didn't have the job I did, I'd probably be without everything. In the 90s, I could afford everything. One paycheck at $9 an hour at 40 hours. Now I'm making $20 an hour and I can't afford shit. Well, sorry for the language. Sad. Work so hard for nothing.
Chris, I really appreciate you sharing your story. It means the world to us that you trusted us with your story. Thank you so, so much. And I wish you all the best in getting to a better situation. I wonder, Andy Newman, what people are saying in response to this. I think a lot of us look at our lives, especially now with the pandemic, and think, there but for the grace of God go I. What's the reaction to this been like?
The reaction to this story has been fairly uniformly people thinking that the city is being a little bit unfair in trying to restrict people from sharing food. A lot of stories that I write about homelessness, some of the ones I write about homelessness in New York City, we get a lot of comments in the other direction saying people are, clogging up the streets and, sleeping on the sidewalk. The city should belong to everybody, not just the homeless. With this story, I think because possibly it's around the holidays and it's about feeding people, it's such a basic, it's like a biblically mandated thing that you should feed hungry people. And any attempt to kind of restrict that, I think, strikes people as a little bit tone deaf.
I'm fascinated to see how this turns out. I understand the point of view of people who feel it's inhumane. I also, having lived in San Francisco for years, understand the point of view of small business owners, for example, who say this has gone too far, the city's got to do something. What do you think happens from here? I know you spoke to one attorney with the National Homelessness Law Center who said that there could be First and 14th Amendment violations that they might try to bring up or that someone might try to bring up. But what's the next step in this before we go?
So, whatever the mayor's office and the homelessness services office come up with, it has to go through the rulemaking process and be passed as an ordinance by the city council. What the lawyer from the National Homelessness Law Center said was that by specifically saying that you need a permit to feed what they call residents without addresses, as opposed to just a permit to give away food generally, that wording seemed like it was targeting homeless people, and that's why that lawyer said that it might not fly. But they could change the wording. There are many cities all around the country that have enacted various kinds of restrictions on feeding people, on sharing food in public, and there have been lawsuits about this. Today in Fort Lauderdale, a group called Food Not Bombs, which actually has chapters all over the country and does a lot of charity feeding. A judge awarded them, I think, $12,000 in damages and has ordered the city of Fort Lauderdale not to enforce this rule that required a permit to feed people in a park. And in that case, it was that the rule was kind of worded so vaguely that there was no standard for how you get a permit, and it just seemed like it was arbitrary. But this stuff is going on all over the country, basically.
Andy Newman with the New York Times, I appreciate you making time for us tonight. Thank you very much. Now, last night we asked you to give us your thoughts on homelessness and hunger in America. Many of you shared very powerful stories about your experiences. Let's get to a few of those. Amanda in Memphis writes, "We live in a city with crushing poverty and tons of problems, but I am proud of what our city is doing to combat homelessness and provide the homeless with services. I'm so happy that we are finally getting a larger women's shelter. A while back, one of my friends was trying to help a woman who was temporarily homeless due to leaving an abusive relationship. There was no place for her to stay, and they had to get her a bus ticket to stay with relatives in another state." Many of you also used our voicemail line. You heard Chris's story about living in his car. Let's get to another story from Clarice. Here's what she left in our inbox.
Was diagnosed with stage 3 breast cancer in April of 2016. I was not able to pay my bills. I lost my job due to having to go to so many treatments. And upon losing my home, I thought that I could be able to go into a homeless shelter. I was told in Philadelphia, I was told that I couldn't go to a homeless shelter because I would be a quote-unquote liability because I was in active chemotherapy treatment. There were no programs to help me. So I ended up sleeping in my car with my child until one of my friends from high school heard about my story, and they let me stay with them.
Clarice, I appreciate you letting us hear your story. Thank you very much. This last one came to us somewhat poetically. John writes, "I used to have a beautiful home, a beautiful wife. Then I lost them both. moved into my minivan, which I had to keep moving around, had to sell what little I had left for fuel and a bit of food bank feed. I had and have a clean record, but I cut myself off from friends and family. I felt so bad, a waterfall of grief. But I've recovered, live with friends on the Colorado prairie, still talk with my wife, who lives now in Florida. My kids still love me, and I them. They understand life is a side effect until the very end. They know that I'm a disabled elder out on a prairie who still does what he can, even if I again become homeless. Blessings. Blessings to you, John, and to everyone who shared their stories. Thank you so much. It means the world to hear what you're dealing with. Please keep your stories coming. Your texts and voicemails and emails are truly the lifeblood of this program. We are at NBC Now Tonight on Twitter, Facebook, and Instagram. You can always leave us a voicemail, 888-575-2NBC, or email us nowtonight@nbcnews.com. Up next, a question to consider when planning for your death. Who gets my phone and the data on it? Apple is the latest tech company letting you designate a legacy contact. We'll show you how when we come back. The smartphone in your pocket, or in your hand, if you're watching this show on this, may have one unexpected benefit. It can help your loved ones remember you after your death. Your texts, emails, pictures, and posts tell your story from your perspective. But when you die, where does all that data go? Who can claim it? And how would that even work? Well, this week, Apple began letting users designate contacts to access their iCloud accounts. It's called a legacy contact. That person will need a special access key and a copy of your death certificate. This feature requires the latest software update, iOS version 15.2. So once you update, it's pretty easy to pick a legacy contact. First, go to the Settings app. That's the gray icon that looks like a set of gears. Tap your name at the top, select Password and Security, and then select Legacy Contact. You can choose up to 5 people that are in your phone's contacts. Most of the major social media platforms have similar options. Facebook users can set a legacy contact or have their page memorialized after they die. Instagram has its own memorial option. Google, which owns YouTube, has an inactive account manager setting. That lets users choose who may access their information and when. For Twitter, you can request access after someone dies. It's quite a sign of the times, right? But what other digital preparations should you make for the end of your life? Let's discuss that with Jim Lamb. He's an estate planning attorney based out of Minneapolis. Mr. Lamb, welcome to the program.
Thank you for having me.
This is kind of a wild topic. It makes sense, but it's something I never thought I'd have to be thinking about. When did this begin to become a thing? Have you noticed in your practice or from other attorneys that deal with estates and trusts that data began to become a growing issue?
Yeah, about a dozen years ago or so, this really started popping up for us. Most of the time when somebody passes away, we would go to their house, work with the family to watch the mail for their paper records, and we'd just go through the things we could touch and feel. But nowadays, a lot of our property is stored online. Our records are stored online. We get account statements by email or by an app. And so it's harder to find those things if you don't know what you're looking for.
How different is it dealing with digital assets of a decedent versus physical assets? I mean, is this an area that the law has even contemplated and gives guidance on, or are you kind of having to figure this out case by case?
Well, about 10 years ago, there really wasn't any law at all in place on this. And so, if we have real estate, stocks and bonds and bank accounts, we have a well-established, hundreds-of-year-old procedure for dealing with that. But with the electronic assets, there was a mismatch between state laws for when you became incapacitated, when you pass away, and then the federal privacy laws for electronic communications. So about 5 or 6 years ago, we started rolling out a Uniform Fiduciary Access to Digital Assets Act. And that really provided a procedure for if you become incapacitated or after you die, for your representatives in your family to come forward and have a process for collecting your emails and other online account data in a reasonably easy way. These features like Apple and Google and Facebook have offered even make that a step easier.
What about other kinds of digital assets like virtual currencies? We're seeing more about Bitcoin and other cryptocurrencies and assets that are stored like non-fungible tokens, NFTs. Is this kind of a similar sort of planning, or are there other considerations?
That's a great question, because things like your virtual currencies or non-fungible tokens, they are completely different. If you don't plan ahead for those, it can be practically impossible to transfer them. Those rely on encryption, scrambling up some kind of data, and you have to have a private key, some kind of password that enables you to transfer it. And if you don't remember it, it's not like you can go to the bank or to your investment company and say, I forgot my password, would you reset it for me? There isn't a central location where you can do that. So planning ahead for your virtual currency is critically important. First of all, we need to know that you have it. Second, we need to know how to access it, or otherwise it could be lost forever.
I can't help thinking, and this is kind of a sensitive question, but I think it's going to come up for real. There are some things on your phone that you might not want other people to look at over your shoulder, if you take my meaning. Right. Exactly. Before I have to let you go, what about those kinds of nuances? I mean, we're talking about really personal, super private stuff that sometimes people only share with strangers online that they may not even want their families to have. So maybe I want you to have the songs that I've got on Apple Music or Spotify, but I don't necessarily want you to have my links and my pictures. How do you deal with that sensitive data that maybe you don't want everyone to see before we go?
Yes, have a separate account for those things. So if you have your bank statements, your credit card statements in one account, an email account, make sure your private things are in a separate email account, and don't provide the password for that. Or even better, put in your will that
Jim
you would
Lamb,
like that
estate
account
planning
deleted.
Oh, I'm sorry. Go ahead. Finish your thoughts, sir. Sorry.
Oh, I was just saying, have that account be deleted in your will. So.
Understood. Understood. This is really fascinating. I appreciate you making time to talk to us about it. Jim Lamb, an estate planning attorney. Mr. Lamb, thank you very much.
Thank you for having me.
Death is just one big new consideration online these days. Another to consider, espionage. Facebook's parent company, Meta, is cracking down on spies for hire. They're increasingly hired to target journalists, activists, and politicians on the platform. NBC national security correspondent Ken Delanian has that story.
Spies for hire lurking on Facebook and Instagram. A new report by Facebook's parent company Meta names 7 organizations as part of what it calls the global surveillance for hire industry, accusing the companies of tricking people into giving up their private data and handing it to authoritarian governments, corporations, and anyone with an enemy who can pay the fee. Their alleged targets? Journalists, human rights activists, even political opponents.
Why should our viewers be concerned about this?
These firms are engaging in indiscriminate targeting journalists, politicians, political activists, and everyday people around the world. And what this industry does is it democratizes snooping. It democratizes spying, and it means that far more people have access to these tools than ever before.
Meta's head of security policy, Nathaniel Gleischer, says almost anyone can be a victim of the unregulated private spying industry. Once the spies earn their targets' trust by friending them on Facebook, they often send them malware that can secretly take over their phones. That's what Facebook alleges happened with an Israeli firm called NSO Group, which has been blacklisted by the U.S. government over allegations that its Pegasus software has been used to target journalists and activists. NSO disputes the allegations. According to Meta's reports, many firms deploy surveillance software that quietly infects smartphones and can turn on cameras, microphones, and location services without the user knowing.
Once you own somebody's phone, you essentially have the next best thing to access to their mind.
Eva Galperin is the director of cybersecurity at the Electronic Frontier Foundation and an expert on digital surveillance.
And since we take our phones with us everywhere, you essentially have a tracking device. You have all of the passwords that somebody uses in order to log into their various accounts from their phone. You have a list of all their contacts, who they talk to. You have all of their phone calls. You have their end-to-end encrypted messages.
Facebook sued NSO in 2019, alleging they sent spyware to 1,400 WhatsApp users. NSO denies the allegations and the lawsuit is ongoing. But today's report names other companies, including Black Cube, another Israeli firm, hired a few years ago by Harvey Weinstein to spy on journalists investigating his sex crimes, according to courtroom testimony. Now, Meta has banned the companies from their platforms. Their new report says Black Cube posed on Facebook as graduate students, human rights workers, and TV producers, all in an effort to obtain alleged victims' personal email addresses to send them hidden spyware. In a statement to NBC News, Black Cube said it doesn't undertake any phishing or hacking, and that it makes sure its actions are fully compliant with local laws. Cobwebs responded it operates only according to the law and adheres to strict standards in respect of privacy protection. The Meta report comes just weeks after the company's rebrand, amidst an onslaught of criticism and potential legal challenges related to its handling of disinformation on its platforms. Meanwhile, Meta says it notified nearly 50,000 people who were spied on across 100 countries.
It's unlikely that any of them knew that they'd been targeted by these firms across the internet.
So how do you protect yourself? Set up two-step authentications on all your accounts and be careful about accepting friend requests from strangers.
The stakes are high because the people who are being targeted are precisely the people who stand up for human rights. And these tools are being used as a way to quash that.
That was NBC's Ken Delanian reporting. The fight against cancer has come a long way, maybe farther than you realize. The makers of a new blood test say that it can detect more than 50 types of cancer. We'll have Kate Snow's exclusive report before we go. This week is the 50th anniversary of the National Cancer Act. It established the National Cancer Institute, which conducts and supports cancer research and treatment. This week, NBC News is running a special series called Chasing the Cure. There's President Nixon signing it. Tonight, we focus on a simple blood test that researchers and doctors think could change the way cancer is detected. Lots of cancers. Here's NBC senior national correspondent Kate Snow.
There are about 12 companies developing blood tests to try to detect cancer right now. This one, the Gallery test, is the furthest along in its development and its testing. And so far, the data that they've found in trials looks very promising.
Cancer was the last thing 76-year-old Jim Ford was worried about. Were you in pretty good health?
Very good health, yeah. I didn't take any pills. I played golf once or twice a week.
Through Sutter Health in California, he volunteered to be part of a study on a blood test that can screen for more than 50 cancers. He was shocked when the results came back positive. Then his physician ordered scans and found stage 2 cancer in his pancreas. Jim and his wife were devastated.
She literally collapsed on the living room floor and sobbed because we were both thinking it was a death sentence.
But that test probably saved his life because the cancer was found early.
This is where the processing begins.
Dr. Josh Hoffman is president of Grail, a Silicon Valley startup that created the Gallery test.
Most cancer deaths are happening in cancers that we're not screening for at all.
Nobody's finding them.
That's exactly right.
Only 5 major cancers have screening tools like mammograms or colonoscopies. 71% of cancer deaths are caused by other cancers.
We're losing almost 2,000 of our loved ones every day, and it's because we're finding most cancer too late.
Gallery looks at blood for DNA shed by cancer tumors. If it sees that DNA, then it predicts where the cancer is.
So if it says cancer signal detected, predicted location, ovary, the doctor will know to do an imaging test of the pelvis.
The Gallery test is available now by prescription, but is not covered by insurance. Cost to the patient, $950. A positive result is not always right. Up to half will turn out not to be cancer. But researchers at the National Cancer Institute say the results so far could potentially revolutionize cancer screening, and they're designing bigger studies. After surgery, chemo, and radiation,
how are you?
Jim's surgical oncologist says his latest scan looks great.
To catch it at stage 2 is a big deal.
Yeah, I mean, it's like winning the lottery.
Jim is hoping his story might save others. He recently got to hold his new granddaughter.
I was able to go back and see her. It meant a lot.
Those are happy tears, right?
Yeah, very much so.
I did ask the company, really a blood test for cancer? It sounds too good to be true. It's something that Theranos promised and did not deliver on. That's a trial ongoing right now. The company says to that they are being very transparent, that they are doing scientific, rigorous trials and have reported the results. The National Cancer Institute, as you heard, thinks that this does have a lot of promise. Back to you.
All right, thank you, Kate. That's NBC's Kate Snow reporting. Finally tonight, we'd love your help with a story about medical costs, specifically emergency room costs. This week, the Wall Street Journal looked at the cost of some ERs in Boston. They were only 3 miles away from each other. They all saw the same hypothetical patient, but the difference in the bills, $400 in some cases. We'd love to know what wide range of prices you see at the doctor, particularly when you visit the ER. So tell us your story. We are at NBC Now Tonight on Twitter, Facebook, and Instagram. Leave us a voicemail, and we understand if you want to keep some medical information private. 888-575-2NBC or email nowtonight@nbcnews.com. We'll share some of your stories tomorrow. Thanks for making time for us tonight. Until we meet again, I'm Joshua Johnson. Good night.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.